The South Cotswolds Frailty Service was set up to care for and work with people with frailty. So we do what we call a comprehensive assessment, which is very, very inclusive, including health, social bits, well-being, housing, you name it, it's within that assessment, and then we work out a plan of action to help that person in whichever way they want to do it. So that's the me at my best plan, and then that's reviewed.
I've got macular degeneration, which means I can't see to read, write, knit, sew, anything. And I can't see faces. I'm looking at you. I know you're there and I can see you, but I can't see your face. I have carpal tunnel syndrome, which means my fingers are dead. So I really can't use those very well. I'm a diabetic, and the lovely nurses come every day to give me an insulin injection. And I've got osteoarthritis in my lower back, which means that I can't walk properly without pain.
Flora Bailey is very well known to us. She's been a long-standing patient, and as she gets older she's gradually got more medical problems and become frailer and become more at risk of admission. One of the things we found useful about the Frailty team is being able to have the senior nurse who has clinical experience and expertise, and also having an HCA who can go in and check on the patient and signpost them to other resources and other facilities that are available when the expertise of the nursing person isn't needed. And having that flexibility within the team has been really useful to our patients.
During my assessment, I realized she had back problems and mobility was reduced because of that. So I made a referral for physio. And then we agreed that I'll be visiting here weekly, just to see how things are going. I think my visit made a difference in a sense whereby she knew that she could come to me if she had any problems, she could ring. And that referral that I made for that time, it helped her with her mobility.
I am listened to every time one of them comes. It's wonderful. And as I say, there's always a result.
I would have been very medically driven before doing person-centred care, so I would very much hope I wouldn't have treated Flora like Flora has diabetes, therefore Flora has this, therefore, but there probably in truth would have been a bit of that. So it would have been a very much more medical model, so we would have been working on okay, Flora's HbA1c is this, I need to get it down to that. I think it would have been a much less individual and actually much less person-centred. I think once you work in a person-centred way, it's quite subtle but very powerful. So I do a lot less talking, which will be surprising to most people, and a lot more listening. And it's a lot more about we rather than I or you. So it's a lot more working with somebody, not doing to, and a lot more about enabling somebody to be the best they can with, with whatever it is that we're working with or towards.
Working in a personalised way, it gives patients more of a choice, really. It's more about them. It's all about them really making their choices, and us as professionals respecting their choices, their values.
I would recommend the Frailty service to anyone if they're lucky enough to get it. It's wonderful.